Ohio State's Nurse Residency Program is a journey of growth, support, and learning. Designed to empower new nurses, the program provides a strong foundation in evidence-based practice, interdisciplinary collaboration, and essential psychosocial support.
The Nurse Residency Program really helps with the understanding and enhancement of the residents' understanding of evidence-based practice, or EBP, by immersing them in it from the beginning. We get nurse residents involved in the policy, procedure, clinical practice guideline, which at Ohio State is already evidence-based, but having them understand the why of what they're doing in their daily practice really enhances their ability to critically think and adapt that clinical judgment as they go throughout their orientation.
Through workshops and case studies, residents learn to apply the latest clinical research in their daily practice, ensuring that their decisions are grounded in evidence and best practices.
Case studies within the hospital that were actual patients, talking about different things that happened and could have changed that would have prevented better care. So that helped a lot in my care as a nurse and providing the best care I can with my patients and learning from those case studies about what's wrong and what's right.
Transitioning from academic life to clinical practice can be challenging, but our program ensures new nurses feel supported every step of the way.
The residency program actually brought me a lot of peace. Even just having the concept of it served as a great foundation for me to know that I'm allowed to ask questions and I'm allowed to grow as a nurse.
Having a group of peers that were going through the same things that I was going through, whether it was anxiety before a shift or maybe losing a patient, having that emotional connection and knowing that other people were going through the same things really helped.
Practical skills and confidence are at the heart of the program. Through simulations and hands-on practice, residents gain the confidence to handle complex clinical scenarios.
Being able to know the textbook side of things and then also know the tangibility, I'm able to put a practical essence why I love my patients in the first place. And I have the skills to put that love into practice because I have the knowledge, but then I have the reinforcement of what that looks like in practice.
It's a great way to kind of troubleshoot through your own thought process without feeling that added pressure of being in a live patient situation where it really does matter to make the right choices.
Ohio State's interdisciplinary approach teaches nurse residents how to collaborate effectively with a range of healthcare professionals for the best patient outcomes.
We had a huge emphasis on our safety check-ins. When we roll the patient to the OR, we do our sign-ins and timeouts, where we all talk about the patients, what we'll be doing for them, and any issues that we anticipate having or things that we could do to help either prevent those issues or if they do arise, what we can do to address them.
The interdisciplinary collaboration is wonderful because it has brought experts from all the different fields around the hospital to help reinforce kind of nursing collaboration. They really bring this wonderful wealth of professional knowledge from their own studies and help kind of reinforce some of the things that really contribute to the overall well-being of the patient that isn't just nursing and is very important into patient outcomes.
Our nurse residency program provides resources and activities to help new nurses build resilience and manage stress, ensuring their well-being and job satisfaction.
They meet with each nurse resident at a minimum of every other week, along with their preceptors and the unit leadership team, to ensure that they have a seamless transition from academia to clinical practice.
I have found it beneficial to have those strong nursing friendships because sometimes it's hard to bring your work stories home and you always need a friend to call that can understand what you've been through during the shift.
For many, the residency program is a path to fulfilling personal goals and discovering a passion for nursing.
I love that OSU listens to their employees. I know that whatever they do, they're listening and they're trying to make it better for the employees. I feel like our management really cares about us.
The Ohio State Nurse Residency Program provides a strong foundation, empowering new nurses to make a difference every day. Join us and become part of a team dedicated to excellence in patient care.